Good evening and thanks for joining us. There is no good news tonight about how the bulk of this country is handling the second wave of COVID-19. Many hotspots, with the exception of the Atlantic bubble and the north, are confronting a situation that is worse than the first wave. Nothing about the virus has changed from the spring. We know the best way to stop its spread right now is to stop people from coming into contact with each other. Here's the overall picture. More than 4,900 new cases have been confirmed in Canada today. More than 80 more people have died. Apart from Atlantic Canada, which has sealed itself off, and the territories, case numbers are surging. Both British Columbia and Ontario broke daily case records today. In Manitoba, the worst per capita in the country, there were more than 470 new cases. In Alberta tonight, Premier Jason Kenney is back in self-isolation after coming into contact with someone who has COVID-19. Case numbers there are surging. The number of Albertans hospitalized with COVID-19 has hit a record high. There are now 51 people in intensive care, up from 30 a little more than a week ago. More than 400 doctors have pleaded with Kenney to impose circuit breaker restrictions to stop the spread. Today, he didn't do that. No businesses have been told to shut their doors, but bars and restaurants must close by 11 p.m.
This two-week push is, I believe, our last chance to avoid more restrictive measures that I and most Albertans desperately want to avoid.
As Heather Yourex-West explains, there are fears without tougher restrictions now, the health system could soon be in crisis.
After a summer of relative calm, doctors within Alberta's health system are preparing for a battle. For weeks, the number of daily infections has been rising, and now many of the patients are in need of hospital care.
I think everybody knows what's going to happen within the hospitals. Everyone is scared of what's going to happen.
The escalation in the last week alone has been startling. Between November 4th and 11th, there were more than 5,000 new infections, 53 new hospitalizations, and 16 additional patients sent to the ICU.
It's likely that in 10 days' time, that will be maybe not quite doubled, but supposing we have 80 patients in the ICU system will collapse.
We are at a dangerous juncture in our province.
Alberta's Premier, who is again isolating after being exposed to COVID-19, agrees the situation is serious, but believes targeted measures will be enough to bend the curve down.
We think it's necessary at this time to bring in limited, focused, targeted measures that reduces opportunities for viral spread without imposing significant broader negative impacts on our society, on lives and livelihoods.
Emergency room doctor Joe Vipon fears the measures will not be enough.
Really, I don't think the government has quite grasped the seriousness of where we're at and the depth of what we need to do in order to get out of this.
Dr. Vipon is among more than 400 Alberta physicians calling for a short, sharp period of lockdown. How long may depend on how bad the problem is allowed to get.
The idea that Alberta can take a 2-week timeout and hey presto, COVID will be under control is foolhardy. You're going to have to take 2 months, not 2 weeks, because you have climbed the mountain so high that it takes that amount of time to reach the bottom on the other side.
Because the people in hospital now were infected weeks ago, so we don't yet know how serious the situation in Alberta truly is. Heather Yourex-West, Global News, Calgary.
In Canada's biggest city, community spread is out of control. Toronto has record levels of COVID-19 now, and today the city's mayor had a blunt message for people.
Stay home, work from home, study from home. Don't go out except to shop once a week by yourself. Don't go out to do anything unnecessary.
Ontario's premier, though, has resisted reimposing tough restrictions. New modelling released today shows that province is headed down a dangerous path. The new projections predict, given how fast the virus is spreading, Ontario could have 6,500 cases per day by mid-December. And under every scenario in those models, the province's ICU capacity is expected to be threatened within just 2 weeks. The projections are dire, and yet Ontario's premier says the economic risks of another lockdown are too great. Eric Sorensen reports.
2 mid-October weddings here were linked weeks later to around 50 confirmed cases of COVID-19. But it's not just big events in hot zones like the Greater Toronto Area. Many Ontario health regions are counting more COVID cases. The pandemic is worsening. In the weeks ahead, a projected 5% rate of COVID growth in Ontario would likely exceed the rate in some European countries that are already in some form of lockdown. New Ontario modelling shows hospitalizations in gold have risen 61% in the last 3 weeks. Patients in ICU beds have almost reached 100. The province projects ICU occupancy will exceed 150 beds within 2 weeks. In a worst-case scenario, it would exceed 400 beds in 6 weeks' time, seriously straining Ontario's capacity to care for acutely ill COVID patients.
Those projections, as you said, are alarming. You need to return to what we did during the first wave. You need to return to that household limitation.
A group of Ontario doctors says this province must do more now to flatten the curve.
We're recommending that people stop all non-essential services, including public events, of course, so that we can gain control of the spread while we strengthen public health measures.
Ontario's opposition leader called for a 2-week circuit breaker for hotspots like Toronto, a brief but thorough lockdown to stop the spread. But Ontario's premier says he has to balance the health of Ontarians and the economy. He does not want a lockdown.
How can you measure the depression, the mental health of businesses and the owners when all of a sudden they go belly up? There has to be a balance. Priority, number one, on health and safety, but very close beside it is the economy.
Ontario prepared to open more widely this weekend, but Toronto said no to reopening indoor dining. It's led to mixed messaging. The premier wants the economy open, while Toronto's mayor says this.
Please stay home as much as you can. If you have any doubt about whether you really need to go somewhere or not, don't go. Stay home.
It's a hard needle to thread. How to patronize businesses to keep the economy afloat while being urged to stay home. Eric Sorensen, Global News, Toronto.
BC updated its COVID-19 modelling today, too. It is projecting new cases could double in the next 13 days unless people reduce who they come into contact with. Hospitalization numbers in BC are already above the peak they were this spring. And BC's provincial health officer says the majority of new cases can be traced to household gatherings and community interaction.
We started to see young people again driving infection in the province, whether it's through social interactions primarily, whether it's through work interactions. And what we're seeing now is spillover into older age groups where people are more vulnerable.
Manitobans are living under the tightest restrictions they've faced since the pandemic began. The entire province is in the critical red zone now. The test positivity rate in Winnipeg is 11.4%. That is the worst in the country. And the message there, too, is stay home.
If we follow these orders, don't try to find ways around them, don't try to find ways that Manitobans can gather, we'll start to see these numbers come down as we did before.
Under the new restrictions, Manitoba schools will remain open, but most non-essential retail stores, gyms, hair salons, and houses of worship are closed, and people are being urged to avoid all non-essential travel.